Okay, welcome one more time to the Genius class. The next thing we'll be looking at the nasal polyps. So let's share the screen. So let's look on the screen one more time. So we'll be looking at our nasal polyp. Genius class 2023. So candidate instructions, you're an FY2 in a GP practice. Okay, a 57-year-old man has presented with a nasal discharge. He has a history of hay fever and is on antihistamine. What you must do is to assess the patient and address the concerns. Assess and address the concerns. Let's look at the background information. He has right-sided nasal blockage and discharge for the past 2 weeks. It's watery discharge and constant. He suffers from hay fever and takes antihistamine. Usually the hay fever comes in summertime, around the month of May or April maybe, okay? But he's surprised that this time he has got it in winter. He has taken antihistamine, but not helping. Usually the antihistamine, they do help. But on this occasion, they are not helping. Approach to this particular task, as you can see from there, yeah? Approach to this particular task is going to take the history of the presenting complaint. So ask about the nasal discharge, the odd part of the nasal discharge. Did it start suddenly or gradually? How long has he had it for? Is it getting worse, progression, getting worse or getting better? Anything that makes it worse, aggravating? Anything that makes it better, relieving factors? Okay, is there any bleeding, any sneezing, any nasal blockage as well? This particular patient has got nasal blockage. Is it bilateral or unilateral? Is it on one side or on both sides? This particular patient has got on one side. Does it happen on a specific time of the day or specific places, or when you go to specific places? No, it happens constantly at any time of the day and anywhere. There is no specific place. So let's look at the differential diagnosis. Nasal polyps themselves, there will be a feeling of a mass in the nose. If a patient, for example, feels there's a mass in the nose, may feel that. A foreign body can also cause that symptoms. Sinusitis will cause a headache, green nasal discharge, allergic rhinitis, hay fever. Okay, there will be sneezing occurs in the summer or spring. Upper tract infection, there's a watery discharge. There will be other symptoms like a cough, running nose, okay, and the sore throats, yeah, fever. There will be other symptoms suggesting an upper respiratory tract infection. Okay, good. Now, what are the symptoms of nasal polyp? There will be nasal blockage. There will be a nasal discharge. The discharge is watery. So ask, is it a watery? What's the color? Greenish discharge may suggest suspected infection like in sinusitis. Blood stained may suggest suspected tumor. Okay, headaches. Are there any headaches? Is there any snoring or obstructive sleep apnea? So ask the patient about if they feel tired during the day or feeling sleepy during the day, or if they do snore at night. Because if there is a nasal polyp, that will make it difficult to breathe at night and make the patient difficult to fall asleep, and therefore will be tired and sleepy during the day. So it's important to ask about these ones. Ask the other history, complete the PMAF-TOSA, ask about the effects of the symptoms on patient life, and of course, ideas, concerns, and expectations. Do not forget to ask the patient, is there anything you feel yourself could be the cause of the symptoms? Is there anything you're worried about? And the expectations is at the end of the station. Then, after you have taken the other history, you do thermal examination. We need a nasal speculum examination. We also need facial tenderness palpation on the face because there is discharge from the nose. It could be sinusitis. We need to check the observations to see if there is a fever. So nasal speculum examination to look inside the nose, facial tenderness palpation to check for sinusitis, and the observations occurs for a temperature. In this particular case, you are given a picture, as you can see, of the nose, and you can see there is a polyp in the nose itself, as you can see on this picture on examination findings. Okay, good. Then you explain the diagnosis has got the nasal polyp. The cause of nasal polyp is not known, but most of the times it is associated with the chronic, of course, inflammation, chronic rhinitis or sinorhinitis, yeah? Allergic sinusitis, so ask if there's any past history of allergic sinusitis. Has got hay fever. Sometimes that can also be associated with the chronic inflammation in the nose and could be a risk factor. Okay, but it's not associated with allergies at all. It's not about the allergies, it's about the chronic inflammation in the nose or sinuses. Okay, so he has got a nasal polyp. Management, refer the patient to the ENT. Remember, unilateral polyp should always be referred because it could be a sign of malignancy. So this patient should be referred to the ENT. It doesn't have, okay, refer to the ENT, this patient, okay, to exclude what? Malignancy. Good. Then explain what the specialist would do. The specialist would perform some investigation, in particular an endoscopy, okay, or rhinoscopy to look inside the nose. And they may offer treatment that may include medical or surgical treatment. Then we have to explain more. So treatment is what? Medical or surgical. Then we have to explain more. What do you mean by medical? So the first line medical treatment is steroid nasal drops. The steroid nasal drops are used for nasal polyps, okay? Patient has to continue using antihistamine as well, okay? Nasal douching or washing in the nose with what? With saline, washing in the nose with saline. So these are the medical treatment that may help. If the medical treatment are not helping, nasal steroid drops containing antihistamine, washing in the nose with saline, that is nasal douching, okay, then they can try surgical if medical is not helping. Surgical treatment is surgical removal of the nasal polyp, okay, if medical treatment is not effective. Okay, now what else? In this particular patient, offer the leaflet, okay, safety net for any nose bleed. Picking of the nose sometimes can lead into bleeding, okay? So avoiding, of course, picking the nose, because if you feel uncomfortable in the nose, you may be forced to pick the nose, okay? Thank you very much. This is the nasal polyp. Thank you, and welcome again to the Genius Class 2023.